Shall we go ahead?
Yep, go ahead, Kent.
We call the meeting to order. If everybody could please rise for those that can and do the Pledge of Allegiance. I appreciate that. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. And will remain standing or in repose for any Rotarians, family members that we may be aware of. That I know Paul Livingston's father-in-law passed away, so we'll want to bring up the Livingston family. Anyone aware of anyone else that needs a thought or a prayer?
Just continue to keep the Goring family in our thoughts and prayers. Had a chance to go by Don and Doris's this weekend. So just keep that family lifted up.
Thank you. Yeah, great. Thank you, Jeff. All right, let's pause just a moment or two here. All righty, we may be seated. And you know, it occurs to me, I don't know if we have any guests, and I don't know how we recognize guests over Zoom. Karen, are you aware?
I have not.
Well, okay, with that, if there are any,
come on.
I'm sorry. Are we good?
Chat.
Well, if you're a guest,
Carolyn Johns. Lynn Carey has Carolyn Johns from the Ames Morning. Hello, Carolyn, welcome.
We can also let them self-announce.
That's true.
Well, with that, if John, you would go ahead and please lead us in the welcome song, that'd be greatly appreciated.
Sure, Kent. And as you're all aware, it's back to school. It's August. And for me, that always brings up the thought of marching bands. It's great to live in campus town because if you live close to it later in the month, you'll go on campus and you'll hear the Iowa State Marching Band breaking into sections and going at it in preparation. So I thought I'd try to add some of that pep and energy to today's version of the welcome song. So to our guests and visitors, welcome to you from Ames Rotary, Nevada, London, or Paris, from far off lands of the USA. We're glad that you are here today. Come back again whenever you're near. Join us and then we'll make it clear. Around the world you will always be. Welcome at Rotary.
Awesome. Thank you, John. Also, being the first meeting of August, as is tradition, we want to wish those that are celebrating birthdays during August. And John, you're on that list. So happy birthday to all. I think we'll not sing a happy birthday if that's okay, unless somebody wants to do so, let me know. A lot of August anniversaries. Give you a moment just to highlight and pick out one or two on there that you might recognize so that later on when you see them, you can congratulate them personally. I think there were like 24, 25. I don't remember the count, but it was pretty significant. And next, we want to thank those for being a member. 41 years. Louis, you're on our list for 23, as well as David and Karen. Thank you all for your years of service and commitment. It's greatly appreciated. And Jack, we get to celebrate your second year. So thank you for Jack Swanson for being a member. Few announcements. We want to remind you of the August meetings. Next Monday, we will be meeting for the first time in the Ryman Center, the Iowa State Alumni Center at the Ryman Ballroom. And we'll have the privilege of listening to Dave Cook and past District Governor Steve Dakin. So that'll be upcoming on the 9th. On the 16th, we'll be online again only, and we'll have an individual, Nathan Johnson, visiting with us about Musco sports lighting. And the 23rd, we designate as a service day. It just means we won't be meeting that day, but we'll look to other service projects. And we've highlighted Tedesco as the area that the Tedesco Learning Corridor to water trees, which I think they desperately need. But if you're unable to do that, please take another opportunity for yourself or with a few others and serve in another way. And we'd love to know how you do that. It's not an all for one for all. We would like to just make sure we're extending what Rotary's about, and that's service. And August 30th, we're back at the Ryman Ballroom at the Iowa State Alumni Center, and we have a special guest with Dr. Winterstein. So that brings up our August agenda. So make note of that. Karen will continue to send out notices as she always does. Is there any other announcements that I may have missed that somebody might want to share? If you do, just go ahead. I'll give you a moment to unmute and share before we begin the program. Hearing none, I'm going to give the opportunity for two of our own to share about the Ames Vision 2020 plan. We have Deb Schildroth, who's our Assistant City Manager, and we have Jean Kresse, former president of our Rotary Club and our Story County United Way CEO and president. So Jean and Deb, if we'll let you pick up the mantle here. Thank you.
All right, well, thank you, Kent, for that introduction. I'm going to share my screen so you can follow along on the PowerPoint. Do want to thank all of you for this opportunity for Jean and I to talk with you about the 2020 Story County Community Needs Assessment. It was an interesting year in trying to get this accomplished, but we did it, and hopefully you'll find this presentation interesting and the results helpful for whatever interest in work that you're involved with. So I'm going to start out by talking just quickly about the Story County Quality of Life Alliance. What is this group? It's a committee of individuals and organizations who get together and to address the needs and social health determinants of the county. And the Alliance was first pulled together about, gosh, I want to say almost 20 years ago now by Story County Public Health. Their director at that time was Eileen Mullen, and she was wanting to bring together folks in the community to help with the health assessment that was required by the Iowa Department of Public Health. And so we band together at that point in time. And what's our purpose? It's to do a regular assessment of the health needs in our community through a variety of data collection and aggregation, and to help push this knowledge out then to the community so that the results can be used in a variety of ways and work that each and every one of us is involved with. The Story County Community Alliance has the following representation. It's led by Story County Public Health. But as you look at those organizations that are represented there, you can see that we're covering children, mental health, substance abuse, families, YSS there with their array of services. And then we've got several of the asset funders, United Way, Story County, and the city. So when we started working on the 2020 assessment, it was in October, November of 2019, so pre-pandemic. And we sat there thinking, okay, how are we going to do this assessment? In years past, we've contracted with a consultant to do it. Another year, we just did a data review of sources that were available online and used those resources to put together the report. We've also used a couple of different organizations on campus to help us accomplish this. So we sat there and we thought, okay, what do we want to focus on this year? What's going to be a little bit different than years past? And so the question that we arrived at was, what are the most important health and human service needs of the people of Story County and why? So that's the question. answering the question, it took a little bit longer, and we did enlist the help of Nancy France. Nancy may be familiar name to many of you in the community. She's very involved with facilitating different kinds of groups and organizations. She's very active with volunteering at the library. And so we enlisted her assistance to help us put together the data collections to answer our question. And so we ended up using 4 waves of data collection. We did an analysis of data that was available online through the American Community Survey, and then data from our key partners within SQUALA, that's Story County Quality of Life Alliance. And then we also used the Iowa Youth Survey and a couple of other tools that were available at our fingertips. And so one of our SQUALA members took that on and did that analysis. And then we also thought it was very important to survey the people in Story County as to what they feel were the most important health and human service needs. And so that survey went out, it was online, and we had it available in paper format. And 567 people in Story County responded to that survey. We sure appreciate that. We also had focus groups. We thought, again, it was important to pull together community members. And so those focus groups occurred in Nevada and Ziering. We did have one lined up for Maxwell, but that was towards the end of March of 2020. And as you can guess, we had to cancel that because of the pandemic. And then our last wave of data collection was a panel of 13 Story County Health and Human Service experts who directly observe or involved with needs. And we really thought it was important to add this 4th wave because of the pandemic. At the time we added this panel, it was about October of last year. So we were 6 months into living with COVID-19 and felt that there could be additional needs that have come up at that point in time that we needed to make sure and capture. So our first wave was the secondary data review. We got input from local human service agencies. Again, other points of information were from the Department of Education, Department of Public Health. We looked at the diseases, ER visits, those kinds of things. The Robert Wood Johnson Foundation County Health Rankings. All of this is online if you're interested in diving in a little bit deeper, very interesting information. And then we also used other publicly available data that included the American Community Survey as well as ALICE. And that was the report through the United Ways of Iowa, or maybe it's even larger than that. Jean can help clarify that. But again, more information that we could glean from. And on that review, these were the results that popped up. These were the areas of concern. So we've got them here: childcare, healthcare, housing, transportation, livable wages, mental health. Some of these probably don't really surprise many of us, but that's what we found as results from that first wave of data collection. Second wave was our survey. And again, we had 567 people who completed the surveys. We had it out from January 12th to March 1st. Those are just some demographics of people who completed the survey. And then the results of that survey are listed here. So you can see there's some overlap from the first wave of data collection. There's mental health, childcare, food security, income, transportation. So again, we kind of see the coming together of the final results. In the first 2 waves, we've got a lot of overlap. Our third wave was the focus groups, and that involved 15 key community members from Nevada and Ziering. We really felt like rural communities were underrepresented in wave 1 and 2 of data collection. So that we focused our focus groups in the eastern part of the county. And again, the Maxwell group was canceled. The results of the focus group look pretty similar to the previous slides. We've got mental health, we've got food security, suicide prevention, healthcare, income, again, a lot of overlap. And then our fourth and final wave of data collection was the Delphi expert panel. So the panel of 13 health and human service experts that responded to a variety of questions. It was a 3-part process. And so the first question was to review the identified list of needs and add missing needs. So they were provided the information that you just saw in terms of the needs that came out from the first 3 waves of data collection. And then the second question was to rank those needs from most important to least important, and then provide feedback on addressing the top needs. So out of that Delphi expert panel and pulling all of the information together, we came up with these 6 needs as the top priority needs out of the 2020 survey. So mental health services, food security, housing, childcare, suicide prevention, and income. So those have become the needs that we talk about going forward throughout the presentation. And I'm going to turn the presentation over to Jean, and she will take a little bit deeper dive into each of those needs.
Thank you, Deb. And thank you, Rotarians, for allowing us to share this information with you. It's valuable to us in a number of ways. It helps us make decisions based on how to invest our resources. And it also helps our agencies that are working so hard to provide the services do grant writing and those kinds of things. So I'm going to take you through the 6 areas, just give you additional information to what you see there on the slide. But I want to explain this slide a little bit and mental health. And I do have notes, so I'm going to try to stick to my notes. So the box on the left is from the Story County Health Rankings. And it shows that there are 490 individuals for every mental health provider. This specific fact was also identified as an issue during our focus group when we talk about few and poor access to providers. The chart on the right shouldn't be surprising. It clearly demonstrates that this issue impacts all ages. So you can see the ages down below. Mental health is an area where having a good level of crisis management services is critical. It's important to be able to get the caller into the appropriate level of care relative to the problems that they're having. The number of crisis calls from Story County residents in 2018 and 2019 to Irely Ball, which is our community mental health center, increased dramatically from 2018 to 19. Those calls increased by 116%, from 102 calls to 221 calls. And those callers needing hospitalization increased at that same time frame from 12 to 40. Another thing to note in the review is that the number of mental health calls received by the Ames Police Department rose from 1,400 in 2016 to 2,000 in 2018. For our next ranking of the food security, food insecurity, I want to just give you that definition, refers to USDA's measure of lack of access at times to enough food for an active healthy life for all household members and limited or uncertain availability of nutritional adequate foods. So food insecure households are not necessarily food insecure all the time. Food insecurity may reflect a household's need to make trade-offs between important basic needs such as housing or medical bills, as opposed to purchasing adequate food. According to Food America, the food insecurity rate in 2018 in Story County was 8%. This means that nearly 8,000 people in Story County would be considered food insecure. And of this total, 26% are actually above the other nutrition programs, the thresholds of 185% of the poverty guideline. 1% are between the 160 and 185%, and 73% fall below the SNAP threshold. So SNAP is the Supplemental Nutrition Assistance Program that some may refer to as food stamps. And according to Feeding America, the average meal cost for Story County is $3.09, which if we calculated that based on the 8,000 individuals that are food insecure, it would take an additional 4.1 million to close that gap. In the area of housing, what you see here in the chart is the percentage of individuals that are paying more than 30% of their household income on housing. This statistic is defined, well, I just said it, so I'll skip on that. The chart shows the percentage of households in Story County paying more than 30% on their income for rent or mortgage programs. We often think of Ames being high for rental units because of Iowa State University students. According to the American Consumer Survey, over the 2018, the 5-year average, communities of the estimated number of owners and renters whose monthly costs are 35% or more of their incomes include Ames, which is no surprise, at 53.9%, Gilbert at 35%, Huxley at 54.7%, and McCallsburg at 34.3%, and Roland at 29.4%. So clearly telling us that the housing issue is broader than what happens right here in Ames. In the area of childcare, childcare has been a topic of discussion in Story County for literally decades and across the nation as well. The problem is complex because of all the factors. We need more slots. They need to be affordable for families. We need high quality childcare for children, and workers need childcare in order to keep and maintain their job. And as long as they're working, hopefully their wages will increase from year to year. So even though childcare hasn't been necessarily focused on as a workforce issue, though it is, it definitely came out during the pandemic. In mid-March of 2020, when the school districts closed down, we lost 700 childcare slots in the after-school programs, 700. Shortly after the schools closed, we had two of our four nonprofit childcare centers close for a short time during the pandemic. And then the one in Maxwell also closed for a short time because of the pandemic. On this slide here, it's kind of hard to see, but I'm just going to talk you through it. It's from the Center for American Progress, and the data included in this report is by census tracts. So actual tracts on the map, which there are 20 total. We group them here for ease of demonstrating the fact that there are fewer slots available than the number of children in that age group. In one area alone, which would be included in the Northeast Ames corner chart, the number of children per slots is 6.7. So certainly we still have that childcare issue, and I know that childcare is especially hard to find for those families that have infants and toddlers. The next area is suicide prevention. For Story County, the results of the Iowa Youth Survey 2018 report shows alarming statistics when looking at the percentage of young people considering suicide. The lighter green shows percentages for both male and female. Dark green is males only, and the yellow gold is females only. The first set of graphs is all grades, and the following three are for grades 6, 8, and 11. The survey asks the question whether the student has seriously considered committing suicide during the previous 12 months, with numbers like 14% of 6th graders, 20% of 8th graders, and 31% of 11th graders answering yes to that question. It is clear that the county has to see suicide prevention as a critical need moving forward. The National Alliance on Mental Health reports that annually 1 in 5 Americans experience mental illness each year, 1 in 5, and annually 1 in 25 Americans will experience serious mental illness. The impact of mental illness on children in the United States is equally serious. 1 out of every children ages 6 through 17 years old will suffer a mental health disorder every year. Again, that's 1 out of 6. Moreover, 50% of all lifetime mental illness begins by age 14 and 75% by 24. Suicide is the second leading cause of death among individuals ages 10 to 34. And overall, suicides are the 10th leading cause of deaths nationally. In the area of income, we know that we have a very diverse county with a variety of commerce and workforce training. This results in a significant difference in the level of income across the county. The income inequality of a county is determined by the ratio of the mean income for the highest quintile, the highest top 20% of the earners, divided by the mean income of the lowest quintile, 20% of earners. Some common effects of significant income inequality are higher rates of health and social problems, lower level of economic growth over time, and lower satisfaction within the population. As shown on this table in this slide, the income inequality for Story County has remained consistently high during the periods 2015 through 2018. Story County is the lighter green. The chart compares it to Boone, Hamilton, Hardin, Marshall, and Polk. The results of having a consistently high income equality level year after year places the people at the bottom at a disadvantage. Within the report, the actual report is more data on the median and mean income broken down by households in Story County. And then just to note, many of the individuals living in poverty don't have the safety net in place to withstand a sudden unexpected expense such as car repair or medical bill. And during the pandemic, many individuals living in poverty also faced decrease in the number of their hours worked, which translated into fewer dollars to cover the basics, which we call the basics being food, housing, childcare, healthcare, transportation, and some kind of cell phone. Next, I'm going to talk a little bit about, a little bit about the action steps. Deb, is that yours or is that me? I'm sorry, we've done this a few times, but I think I'll take it through the next couple slides.
Yes.
So based on some of the information that we received from the panel of experts, here are some action steps that they suggested to increase partnerships, increase opportunities, increase support. So you can see all of those. I won't read them to you. And I also want to note that the slides that we presented and the statistics I presented is just a portion of the 120 plus page needs assessment that we actually concluded. I do want to report on another opportunity that we had during the last 12 months. United Ways of Iowa, which is our statewide association, partnered with a team at University of Northern Iowa to do a COVID-19 financial impact survey. The study's purpose then was to assess, based on ALICE, those individuals that are are still struggling, but not eligible for supports. And the survey was launched from September 28th, 2020, and closed on November 2nd. It was a paper survey that was distributed as well as an online survey. Individuals reported their zip codes. And so based on the zip code of the almost 3,000 surveys completed, 365 came from Story County. Since this wasn't part of our original community needs assessment, we did have an opportunity to kind of look at the needs assessment and then compare it to the United Ways of Iowa survey. This graph shows the response from United Way survey, and they answered the question, what are your top concerns about the upcoming weeks and months? And unsurprisingly, the top concerns were directly related to the pandemic, specifically a loved one contracting COVID. On these concerns, we did see some interesting overlap and a little bit of deviation from the key health and human service concerns that were identified in the 2020 needs assessment. And we had a team member go through these, and you will see on this chart, you've got the 6 categories that Deb has highlighted. And then the SQUALA assessment and where they did rank. So it's ranked 1 through 6. And then the United Ways of Iowa COVID-19 study. And you can see that for both of those studies, mental health was #1. In the area of food security, although it was 2 on the community needs assessment, it fell #4 on the UNI study. And then so not too far off from the survey that we did, the actual community needs assessment that we did. Childcare was a concern, so that's kind of relatively both. And I'll leave it at that, Deb.
Okay, so we've got some next steps that we'd like to share with you. In addition to the Story County Public Health turning all this information into the Iowa Department of Health, Public Health, we think there are things that we can do here locally to advance these needs and to call for action within the work of the community. And of course, the first one is sharing and discussing this report. We can certainly share these slides with Karen, and we can share links to the reports. Those links are on various different websites at this point in time. And I know there are hard copies of both the full report and the United Way of Iowa's report at all the libraries in the county. So if you wanted a hard copy to look at, the libraries would be a good place to go. But we want to make sure and disseminate this information and then work within groups to strategize actions to address these needs. Look at leveraging current opportunities and partners to address these needs, reviewing demographics and the services of current users, and determine which underrepresented groups are out there and how we can expand services to thoroughly serve those groups. Use the data to secure grants, contracts, and donations. This is something that we talk to our asset agencies about. Here are the top needs, and please use the data to secure other kinds of revenue sources that you may find along the way. We want to enhance community engagement, again, partnering to address the needs, and then advocating for policy and practice changes. And this can happen locally as well as talking to our legislators as they go into session this next year and address needs that have come up. So at this point in time, Jean and I have finished our presentation, and we are open to questions and comments. Thank you.
I'll go ahead and read what we have in the chat. Let's see. Is shop, I'm not sure, shop only from, oops, I lost it there.
Oh, let me back. Do you want me to keep sharing?
Yeah.
Okay.
I apologize. I'm not sure what. Karen, I lost the questions. I'm not sure.
Oh, I'm going to try to guess the question, and is SHOP only open to Iowa State students? Maybe was the question.
That might have been it. Yeah.
So just to let you know, there are 22 there are 22 food pantries in Story County. There are 6 that are based at different schools in the community as well. Iowa State SHOP did expand this last year and they have a new location, so it's open for students. And of course, you all know about Food at First. Heartland Senior Services, of course, has the congregate meals, the home delivered meals, the summer enrichment programs that are funded in part by asset funding also have meals provided in Ames, Nevada, and Collins. And this year with the pandemic, this last year with the pandemic, there were quite a few school districts that took advantage of the grab and go program that was allowed through the USDA. Now, if that wasn't the question, then I just answered something that you didn't really want to know.
Well, I found it of value. Any other questions from any of the members on board here? Any thoughts?
This is Jeff here. On either of the reports, what I'd be interested in knowing if it's available, does either of the reports show length of living in our community?
I'm not sure I understand the question.
Well, I just would like to understand the
Length
data.
of, like how long they've lived here?
Yeah, how long they lived here.
No, I can honestly say that I do not believe we asked that question, but
it would be interesting to know if these are long-term residents, short-term residents, so we can get some feel for how growth might be happening. And is it happening because of new individuals moving into the community, or are these long-term residents who are falling on hard times? Not that it would make a difference in terms of service, but it would give us some sense of, are the level of services that we're providing attracting individuals?
Mhm.
There are a couple of different things that my mind is playing with as I was processing the data.
Well, and further, I think Warren's question alludes to that as well. What is the impact of ISU students on the income data of Story? Oh, I'm sorry, that's Erica. But Warren had asked, were the Iowa State students also involved in part of the surveying, and how would that potentially impact or skew the results, if at all?
So Jean, has that ever been looked at?
It has in the Alice report specifically. So Alice is that asset limited income constrained employed. And there was the second time Alice came out, we did disaggregate some of the data from Iowa State students, but keep in mind, it's harder to do that because not all Iowa State students live at 50011. And not all 18 to 24-year-olds that live in Story County are Iowa State students. So you have to pull out all of that data. So if you just look at, for example, the census data, poverty is broken down by age group. So you'd pull out that whole 18, I think, to 34-year-olds. And so you'd just really be looking at somebody who's older, or you'd be looking at children 18 and under. And I know that in children 18 and under in Story County alone, it's 8% are living in poverty. So it's kind of tricky to do that. But certainly we know, because of the information that we've gotten from SHOP, for example, that there are students at Iowa State that have struggled with food security, number one. I don't know how much the university keeps track of students and where they are in their economic stability, how many are actually students and not tied to family income and have to live truly on their own. So I think that answered.
And we did have a small percentage of students that responded to the survey that was online. And then I believe, and I'd have to dig a little bit deeper into the housing information, but I know several of the reports that the city is required to file with HUD and CDBG. They do require that we're counting the students. So when it comes to some of the rental numbers, students are included in those.
And Erica, you had a question out there. Did you want to go ahead and address it, or has it been answered for you?
Guys, I was trying to get unmuted here. Yes, I think my question was answered as far as Iowa State students in the data. I mean, it sounds like they're obviously included, but there's also people of the same age bracket within the county that were surveyed who are not Iowa State students, and so it impacts that. It would be interesting to know just by volume, though, how many 18 to 24-year-olds were surveyed and how, as compared to how many there are within the county, just to get an understanding of what that student impact is on the data. And again, like Jeff said, not that doesn't, I mean, obviously services still need to be provided. It would just be helpful to understand how that's presented.
And we did have, so on one of the slides, we did have it broken down by 59% of those that responded were between the ages of 25 and 54. 5% were students. So I think that it's probably underrepresented of students, considering there are close to 30,000 students on the campus. I think it's something that we always have to talk about, and something that we always want to consider as we move forward.
Absolutely. Thank you very much. I appreciate it.
Thanks, Erica.
Deb, this is a question to you with the various federal, COVID relief funds coming into communities or the state. Will there be any financial support to be able to be prioritized using data like this as the city makes decisions going forward?
Yeah.
I know there's some discretionary money in those pools that communities are getting.
Yeah, certainly. So the city has been receiving, we started receiving late last summer funds from HUD and community development block grant funds that our housing coordinator has put to use for rent, mortgage, and utility assistance. And we haven't went through all of that money yet, but I know people have been served for anywhere from 6 to 8 consecutive months with their rent and utility and mortgage. Several of them are starting to drop off that assistance. It may be that their job situation has improved, or they've found another job. But we do still, and I don't know numbers wise, but we do still have a handful of people that are still struggling and need the assistance. And so they continue making those requests. And then Warren, I think you're also talking or referring to the ARPA funds, the American Rescue Plan Act funds that Ames communities that are considered entitlement communities received a direct payment of those funds. Ames will receive up to 14.7 million, I believe that is. Portion of that can be used for certain things, and then another portion can be used for projects and infrastructure that has to do with water, sewer, and broadband. And so we're still putting together a plan. None of those dollars have been used yet, but we're still putting together a plan on how those funds will be used. We are part of the thing we have to do is calculate the loss of revenue for 2020 and then for 2021 in order to use those funds and then report back. But so that the planning is still occurring with how we're going to utilize those, but they can be used for things like food security, rent, and utility. Think other kind, childcare, both to agencies and families who need that support. Does
With
that
the
help?
federal housing moratorium ending the end of July, do we have any sense of how much of a housing crisis exists in Ames and Story County? Or is that, I know there, isn't the county trying to address some of that as well?
Yeah, they are. Yeah, so what Warren's talking about was there was a moratorium on evictions. It kept getting extended, and this last extension was through July 31st. So people could not be evicted unless there were, I think, criminal kinds of things that were related. But non-payment of rent, they couldn't be evicted. And I believe, if I recall, there was an article in the Des Moines paper over the weekend that eviction due to non-payment of rent, that part of the moratorium was even extended further until December 31st of 2021. So there are certain criteria that have to be met, but it sounds like there's been even a little bit further extension of that. We don't know at this time. You're right, the county is working on making funds available to help rehouse people, or at least keep them in their housing to pay for to help pay for their rent and utilities. But I don't know yet how many evictions the court system is looking at specifically here in Story County.
Jeannie had asked about how many people know about Food at First and food pantries. Certainly that information is available through all of our partners. They all know that. They make those referrals. We also have 211, which is the information calling center for our area in Story County. Iowa State Extension and Outreach is the 211 calling center. So we encourage people that are seeking services to call 211 to talk to somebody about what their needs are, and making sure that they have those services in place. I think there's a network of word of mouth as well. Although when I say that, I think back to one of the needs survey that we did a few years back. We hosted focus groups at Food at First, and I was with one group, and two people in the group, one knew about the summer meals at the Boys and Girls Club, and the other didn't know about that. So, you know, it's always, it's one of those things when you need it, you search for it. You might not know it's out there until somebody brings it up or you need it yourself, but certainly something that we want to try to do as far as getting the information out to folks. John mentioned about prioritizing 1, 2, and 3, the mental health, certainly food insecurity and housing go hand in hand. There's just, it's difficult to say that we would fund or that we would support one service above the other, but certainly that's something that we know it is true. And so you're right on, John, when you make that comment.
The other thing I would add to the food conversation would be our senior citizens and elderly who access Meals on Wheels. Throughout the pandemic, the Heartland Senior Services, who arranges the volunteers to distribute the Meals on Wheels, and the Mary Greeley makes those meals, it went up like 200% because people were not going to the grocery store. It was before all the delivery services really had come into play. And again, there's an affordability issue with delivery services. And congregate meals weren't a thing because of the health concerns. And so Nancy Carroll with Heartland Senior Services continues to say that their need is up, and people are still relying on that meal to help their overall nutrition. And I do know there's a collaborative effort between RSVP and Heartland Senior Services on helping people get delivery service for groceries. They can help people create an account like at Hy-Vee for Aisles Online and get their grocery shopping done. And then a volunteer will go pick up those groceries and deliver them to the person at no charge. So there's that kind of collaboration and partnership going on to help meet the needs of individuals, especially while we're still going through COVID-19 and figuring out then what's going to best meet people's needs. But I want to make sure that people are understanding that we've got food pantries and we've got food at first, and Meals on Wheels are certainly a important part of overall nutrition.
And Carolyn did mention the Plan a Row distributing over 1,200 pounds of food. And I know that one of our food pantries, the Salvation Army, accepts some glean food as well. And then they try as best they can to share it with some of the more rural food pantries. The food pantries out in the county are typically only open one day a week. And so for them to accept fresh produce a week before they're open would be hard. So I know that Carrie McPartland at the Salvation Army has done, her and her crew have done a really great job of getting food to those other community food pantries as well. So I think that that's significant. I'm looking at the chat, so I'm trying to.
Tom Walsh had a question about the sample of the survey respondents. It was not a randomized sample. It was people could complete it if interested. If the sample was not randomized, is it possible respondents who answered the surveys tended to express greater needs? It's possible, or people on their behalf or advocates. That's possible.
I think in the survey that we did from United Ways of Iowa, I think those that responded were typically higher income individuals. And so that's another thing that we're knowing, that in 5 years from now, when we do the next community needs assessment, we want to make sure that we're asking for income levels as well as more disaggregated demographics about the individuals. And then what Jeff had said earlier, asking about the time that they've lived in Story County or the community as well, I think would all be good information for us to collect.
Mm-hmm.
So Carrie put a note in there about the Salvation Army has given out 27,967 pounds of food to other pantries. That's not even to people, but other pantries since October 1st of 2020. So congrats to Carrie and her crew. Summer meals that are happening. Sheila talked about that. At the library has done summer meals for kids for quite a while. There's also been the mental health first aid training that the city of Ames has provided to individuals. I know we had staff member participate in that as well.
And there is one more opportunity coming up for the mental health first aid training in August. And so we'll get that information out. It's 2 half days, 5:30 p.m. to 9:30 p.m. at the library. The first training in August, we had 20 people. And then the training that we just had last week, I believe there were 30 to 32 people that participated. So if the need continues to show like that, then we'll certainly consider additional trainings, especially with students coming back. We've had some student involvement, but with them coming back here in a few weeks, we could look at offering it this fall.
You do this study every 5 years. Do you establish a benchmark then to see what our success has been in addressing these needs?
Yeah, that's one of the things that the Story County Quality of Life Alliance does look at. So we meet quarterly. The large share of our work, of course, is organizing the assessment and getting that completed, but then meeting on an ongoing basis to hear what the needs are and what's being done to meet those needs. And Les White with Story County Public Health, which we could have her as a guest to Rotary to talk about everything public health does, but specific to their health assessment that they're required to do, could help us understand what that baseline is and then how they're measuring against that. Part of what helps depict that would be the county health rankings that are available online through the Robert Wood Johnson Association. So that was one data point that we reviewed, and it does show on a year-to-year basis. Not only the things that we've talked about this afternoon, but it gets into a lot more of the health needs. So diabetes, cardiac, smoking, all of those things, diseases. I wouldn't be surprised if eventually something around COVID-19 gets added in there because of the long-term effects that can have on people. But the county health rankings show a lot of that information.
Okay, great. I'm gonna,
Deb, when all the schools start up in August within classroom learning, do all the associated meal programs come back as well? As far as you know, I assume those would, but I guess I don't, because don't they feed breakfast and lunch in some cases, don't they?
Yeah, many of them are doing breakfast and lunch. And as far as what I've heard so far, Warren, is everything is normal at this point in time. So those programs would be available.
with that, we'll conclude the questioning. If you have anything else, please address them to Karen, and then we'll get those to Deb and Jean, and we can then share any further insight to everybody else. And of course, Jean and Deb, when we get you back together, we'll get you to autograph a book for us for the well child checkup. We'll appreciate that. Also, I came across a quote that I think just really hits what you shared today. Vision without action is merely a dream. Action without vision just passes the time. Vision with action can change the world. Thank you for all that you guys are doing. How appropriate that it's Ames 2020, perfect vision. With that, we'll go ahead and conclude the meeting. Oh, one other thing I wanted to share, Karen did send out an opportunity for service, and it's Blast Back to School. So folks, that's another service area in addition to everything we just heard today to step into if you want to look for something you can do for service during the month of August.
And might I add that Lynn Carey told me today that if you want to send cash, you can send that to the Ames Foundation on Main Street.
Oh, okay. All right, great. Thank you for sharing that. With that, why don't we stand and we'll go with the four-way test. The four-way test of the things we think, say, and do. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendship? Will it be beneficial to all concerned? Thank you all.